Hello, everyone that has joined in. Welcome to the Brilliant Beginnings Childcare Data Landscape Stakeholder Meeting. As we are getting going, to start off, we will give a walkthrough of how to transition to the language of your preference. So we have English, Spanish, and Mandarin. What I will do is give an overview of how to transition, and then we will give an overview in Spanish and then also in Mandarin. And so we do have English, Spanish, and Mandarin interpretation for this meeting. In a few minutes, once we have gone through the rundown here, a symbol will show up at the bottom of your Zoom screen that looks like a globe that says interpretation under it. What you will do is click on that symbol and then click the language you would like to hear. So for this meeting, either English, Spanish, or Mandarin. And it looks like there is an option to hear only the interpreted language. To do that, you click Mute Original Audio. I will now transition over to the slide for Spanish.
Thank you. Bienvenidos y gracias por acompañarnos esta tarde para facilitar el acceso lingüístico. Esta reunión contará con interpretación simultánea al español. Les invitaremos, una vez que termine de dar esta explicación, que seleccionen el idioma para que pueda escuchar la interpretación al español si así lo desea. Y si está en una computadora portátil o de sobremesa, verá un globo terráqueo en la parte inferior derecha de su pantalla y pulse en el icono del globo terráqueo que dice Language Interpretation o interpretación del lenguaje y seleccione el Spanish o español. Si está en un iPad o un dispositivo similar, localice el menú de 3 puntos en la parte superior derecha y seleccione igual Language Interpretation y luego español y siga los mismos pasos. Cuando le toque hablar, recuerde que debe hacerlo en voz alta y clara y a un ritmo moderado para que el intérprete interprete simultáneamente al otro idioma. Si desea apagar el idioma que no sea español, puede ir a Mute Original Audio y así solamente escuchará el español. Muchísimas gracias, que disfruten la reunión. Thank you.
欢迎各位来到今天的加州社会福利局所举办的 Brilliant Beginnings 的托儿服务的目前现况的这个利益相关者的会议。本人在此提供同步中文、英文翻译。假如呢您呢是使用那个桌上电脑或者是手提电脑的话，下面呢有个地球仪，你可以按地球仪，按到那个 Chinese 就可以享受同步中文翻译。假如呢您呢是用手机会用那个 iPad 的话呢，你的荧幕上右边有个3个点，你3点按出来，然后你按 Chinese 也可以享同步中文翻译。你假如只想听口译语言，就只听英文的话呢，你可以点击原文音，就是 Mute Original Audio 那个地方，就可以听到这个我们今天的来宾他们所发表这个英文的原文。谢谢。
Thank you. We will now turn on interpretation for this meeting. I also want to note that we do have American Sign Language interpretation for this meeting as well. We are going to spotlight the ASL interpreter as well as the presenter. And so you should always be able to see the ASL interpretation. To start off, we are going to give an overview of the agenda for today. And so what I'm going to do is quickly stop sharing and then share the agenda. Okay, so you should now be able to see the Brilliant Beginnings stakeholder meeting agenda. As it says, today is Wednesday, December 15th. And the purpose of the meeting today is to give an overview of the vision for Brilliant Beginnings and the Brilliant Beginnings initiative and its flagship project, California Supporting Providers and Reaching Kids, or Calspark. And we'll also have some fun human-centered design workshopping activities. I want to note before we get started that we have given similar presentations in the past. And so some of you may have seen some of the content today already, but we want to ensure that because we have a very large and broad attendance today, we want to make sure that as many stakeholders and people are on the same page. And so we will be looking at this as the last time that we will be having the visioning conversation, and then into the future, moving into next year, we will kind of get to a point that we're able to roll up the sleeves and start getting down to work with Brilliant Beginnings in Calspark. And so today, running through the agenda, we have what we're doing right now, kind of a welcome and address and introduction. So that is slide 1 through 7. And then next we will have kind of a background into recent developments with the childcare landscape and the Early Childhood Development Act of 2020. And that will be provided by Dr. Lupe Jaime Mileham, Deputy Director of the Childcare and Development Division here at CDSS. And that will cover slides 8 through 10. And then also right after that, we will get into our first human-centered design workshopping activity, led by the human-centered design team with Tara Bandu as their manager, covering slides 11 through 13. After the human-centered design activity, we will jump into Brilliant Beginnings and the concept around it. So we'll begin speaking to the goals, priorities, and strategy with Brilliant Beginnings, and then also getting to some of the recent feedback that we've had with some other presentations. That will be led by me. I didn't introduce myself yet, but me, Brandon Mcmillan. I'm the implementation manager for Brilliant Beginnings, and then also Tara Bandu again. Then after the Brilliant Beginnings concept, we will have a human-centered design workshopping activity, another one, that'll kind of get into some of the benefits and downfalls of technology when assisting families, led again by Tara and the human-centered design team. And that will cover slides 25 through 26. After that workshopping activity, then we will get into Calspark, the flagship project for Brilliant Beginnings. And that is kind of what is Calspark, how all of you are extremely vital to Calspark's success, and then talking a little bit about, as I've mentioned, human-centered design, what that means, and our approach to what we call business discovery. And that will be, again, led by me, Brandon, and Tara. And then before we round out the meeting, we will have one more human-centered design workshopping activity, kind of asking what Calspark can do for you. And that will again be led by Tara and the human-centered design team, before we round out the conversation today with some opportunity for question and answer before we adjourn. And so what I will do now is go back to our presentation and get things going. So to start off, a little bit about us. Of course, CDSS has a large number of employees and people that work on so many different things. And so on the Brilliant Beginnings and Calspark projects, we have a number of teams that we're working with very closely. And so that's members of the Research Automation and Data Division, team members from the Information Systems Division, and then also team members from our Childcare and Development Division. We also are working with a number of other teams at CDSS, but the bulk of the kind of the core team includes those three teams. And then I will turn it over to our presenters. So I'll turn it over to Lupe to start out to introduce yourself.
Perfect. Buenas tardes. Good afternoon. Lupe Mcmillan. I'm the Deputy Director for the Child Care and Development Division. And just to say I'm happy to be here with many of you. And also I've worked alongside many of you. So really excited to be working with you in this capacity. And then I'll turn it back to Brandon.
Thank you, Lupe. And as I mentioned, I'm Brandon Mcmillan. So I'm the Implementation Manager for Brilliant Beginnings, and I'm in the Research Automation and Data Division. So I've been working on childcare projects for about 2 years now. And one of the things that I just absolutely love about this work is that I have a 3-year-old and a 1-year-old at home. And as a dad, I want the best for my kids, and I do everything entirely possible to make sure that they have a really good start with their life. And so there's really no better place for me to be than right here working in childcare projects for the state. It's just such a rewarding experience, and I feel thankful for the opportunity. And so I will turn it over now to Tara.
Thanks, Brandon. Good afternoon, everyone. My name is Tara Bandu. I'm the Human-Centered Design Unit Manager, and I am also working within the Research Automation and Data Division with Brandon. And I have the distinct pleasure on working on human-centered design, where it's a place to capture your voice as the user, as the person that we're working with. And it's one of my favorite things to be on this project, to be able to do with you as well. So we'll talk more about how my team will be able to do that. And I'm excited to talk with this audience today, as we have seen some familiar names, but also a lot of great new ones. So thank you so much, and looking forward to speaking with you all.
Thank you, Tara. Thank you, Lupe. So to start off today, we want to just kind of put out there the vision for Department of Social Services. Of course, in the realm of childcare, Department of Social Services has been operating for quite some time in licensing, but we're about 6 months into the transition of childcare programs. And so some of you, this may be the first time that you're participating in a CDSS meeting. And so the vision at CDSS and all of the things that we do, all of the programs that we have, is to create a society in which everyone can reach their highest level of health and potential for a successful life. And that is, of course, regardless of their background and identity. And so everyone in California, everyone in the realm that we serve is entitled to the highest level of health and potential for success. And so that is exactly what we're looking to do every single day. And as you read that vision, it may not be too different from the things that you do and the work that you do or the services that you provide. And so, it's kind of like shared goals that we have, and really looking to how we can partner in the future to accomplish those goals. And so to kind of get everyone up to speed to all of the exciting things that have been happening of late, I'm going to transition over to Lupe to give that overview.
Thank you, Brandon, for transitioning to this slide and having me share what has happened in the last few years, which many of you are part of. And so probably tell our story and this lived experience just as much as I can. So paving the way for California's recent changes really does build on California reforming its childcare and development system. And as part of that story is in April 2019, the California Assembly released its Blue Ribbon Commission on Early Childhood Education Report. Many of you, like I've mentioned, were part of that work and contributed to the Blue Ribbon Commission report itself. And then building upon that, in December 2020, the Early Health and Human Services Agency published the Master Plan for Early Learning and Care, Making California for All Kids. And so as part of that work, it charted policies both towards creating a child and development system capable of flexible serving all children while prioritizing the needs of California's most vulnerable children and their families. So let's go to the next slide. So that takes us to today then. And so building on these efforts, the Early Childhood Development Act of 2020 went into effect on July 1st on 2021. This provides the vehicle for all the child care and development programs, with the exception of state preschool and a few others, to transfer from the Department of Education, which is CDE, to the California Department of Social Services. This maximizes the supports that the state approaches to strengthening our child care and development system to a comprehensive, high quality, and affordable system, building on a whole child, whole family approach. And I say that lightly because I know that many of you already embody the whole child, whole family approach and the services that you currently perform for our families and children. This transfer also allowed us to think about the replacement of the legacy systems and think bolder in regards to our data landscape. So with that, I'm going to turn it over to Brandon to continue our discussion about the data landscape.
Thank you. That was actually a great segue into our next slide. So before we go any further, we want to make sure that we are acknowledging and celebrating all of the fantastic work that you do. And it looks like did we lose the interpreter for ASL? Okay. And so acknowledging all of the outstanding work that you do in all of the work that you do. I think one of the coolest things that I've experienced being a part of the transition is working so closely with so many people outside of state service and really seeing and hearing about all of the great work and also the need and the things that you are all doing on a daily basis that go so far beyond just providing a service, whether there's a fire or some kind of disaster, just at the local level, how much there is that's going out there is just so amazing. And noting that the partnership with all of you is so vital to the success of everything that we do. And so we're looking forward to all of the current collaboration that we've had and into the future, all of the collaboration that we will have. I think that this is the crux of anything that we do at the state, making sure that we are working with you. And there's a quote that we have that's kind of the mantra that we're living by now on this project from one of our previous presentations is nothing for you without you. And so that is extremely powerful, and thinking that nothing that we do should be done without you and your input and your close collaboration. And so we want to say a huge thank you for everything that you've done and everything that you will do. It's extremely appreciated. So now we're going to move into our first human-centered design activity. Tara?
Thanks, Brandon. All right, so for this activity, in order to participate, there's a couple different ways that we can do so. The first of which being the Poll Everywhere link that is currently posted at the moment, polleverywhere.com. And if we want to quickly post the link in the chat, we can do that as well. So it will take just a moment. You can also text this in. So on your phone, text 22333 to that number, sorry, CalFresh ET 529. The CalFresh team was happy to lend us their Poll Everywhere for this session, which is why it's CalFresh. But please do visit this link and we will be able to get started with our first question. If you are not able to log into Poll Everywhere, which will show us all of the responses, you're able to post them in the Q&A, just in case you're not able to access that. But I'm going to put that link into the chat right now. So we'll give everyone a moment just to be able to get started onto that. And we'll go ahead and share our screen, which will also have the link available at the top and all of the login information. Mm-hmm. All right. So for our first question, it's just to warm us up all together and on the same note of, do you use technology in your daily business? And if you do, what kind of technology do you use? Examples would be really helpful, such as, do you take in different types of information like attendance? Do you take in information on certain numbers? And you're able to answer multiple ways into this prompt. So if you're able to add into examples, type out how you may use it, that would really be helpful for us to understand too. And other folks can see how you respond. And we'll give folks some more time to be able to do so. But if you do use specific examples, you can always plug it into those answers. Lots of yeses. So we have a raised hand. I'm hoping to see how we can address that. If folks can please also enter your questions into the question and answer feature, we can also take a look at those and respond to that as well. And the link should be in as well. All right, we have a lot of people answering yes, which is awesome to see. So I'm not seeing, so the link is in the chat feature, but the link is also at the very top of the shared screen. So it is the pollev.com/CalFreshET529. Okay, I think we're seeing a lot of yeses, and I appreciate that response. I'm hoping to see that if you are able to add any additional examples about what kind of technology. Thank you. We have data tracking on demographics, electronic attendance. Yes. Laptops, phone. Yep. Multiple ways to communicate. That's great. Awesome. We'll give this just a couple more moments. Data entry. Zoom calls. Updating providers in R&R database. That's great. Yeah. Direct connections. Tracking attendance. All right. Database software for client info. Develop, support, update, and sell CACFP software every day. Awesome. These are great examples. Providing referrals using the R&R database. Yeah. Enrollment. Surveys. Yeah. Awesome. We'll talk a little bit more about that later too. Software for data analysis and cleanup. communication and data management and reporting. It's awesome. Payments, yeah. Data processing software, email and fax, workshops and trainings. NoHo, DRDP online, ECE workforce registry, case management, virtual group sessions, as well as one-on-one coaching over Zoom. That's great. Okay, awesome. These are great pieces of information and to share the way that you use technology in your daily business. So since we're able to gather quite a few different examples, this is great coming, and we'll have tons more opportunity for you to share more about how you use technology. But I want to also ask for our next question. If we can go ahead and scroll to our next one. Give us a moment. There we go. If you don't use technology in your daily business, can you give us examples as to why not? So for example, if it's Wi-Fi access, if it's financial things that you can't, or your organization doesn't have access to it, training, knowledge, anything to keep you from being able to use technology, or if you just don't need it, or if it's not something that's pertinent to your daily business. Can you help us understand why you wouldn't use technology or why you cannot use technology? Clients have limited access or no access to technology or Wi-Fi. Definitely. Rural, remote, client barriers. We're pretty lucky in our city that we have a lot of Wi-Fi, and we tend to forget that there are so many areas that don't have access, that don't have Wi-Fi. Intake function technology can be cold and a barrier. Human connection is lost totally. Languages other than English. Yeah, clients don't use technology, can't afford technology. Families with high needs often need face-to-face support. Very, very good point. And I see a couple of folks in the Q&A also say some providers don't use technology because they're not comfortable using computers. Sometimes more work and cleanup than simple paper procedure. Cost. Takes too long to get answers when it isn't canned. I totally get that. Limited funding to upgrade or to keep up with the latest technology. So folks, for those having trouble logging in for the web voting, I hope that if you can just refresh your page, or you might have to send an additional text message. But I believe that I've experienced that myself and other Poll Everywhere. If you just refresh your page, typically it can help. So in additional items being translation, interpretation, having trouble even accessing, logging in. Yeah. I see another one is desk reviews. Some providers don't use technology because they're not comfortable. Yeah. Inclement weather, have not technology savvy. Yep, I can even say that for myself. When you go down a rabbit hole, humans so much better, agree. Clients haven't discovered technology benefits. Oh man. Yeah, when it's great when it works, when it doesn't, not quite fun. Yeah, so thank you very much for this edition. I want to be able to open this for additional pieces of our agenda. So we'll go ahead and pause here. Again, we will have so much opportunity to be able to gather this information. So I'm going to go ahead and pass it back to Brandon. And so we can move on with our presentation today, but please do share if you have any other items that you'd like to give us. Thank you.
Thank you, Tara. That was, it's always fun when we do the activities, and of course there are 2 more, so lots more opportunity for fun, and really appreciate everyone's insight and contributions. As we mentioned, it's extremely important to receive your insight and your expertise, because that's how things are done the right way. And so there will be a number of other opportunities today, and of course, moving forward, all different kinds into the future. And so we will transition now to the Brilliant Beginnings in Calspark portion of the meeting today. So starting off with goals, priorities, and strategy, then getting into some recent feedback and insight, just like you provided us today. And then getting into California supporting providers and reaching kids, Calspark. So what is it, or what is conceptualized as, how you are vital to the success, human-centered design, and then ending off with questions and answers. And so to start off, I want to note that with Brilliant Beginnings in Calspark, we are in what's called the planning phase. So we're very early on in this process. And so there's nothing that we've done or decided upon that is, kind of decided upon at this point in time. We are right now developing what these things, Brilliant Beginnings in Calspark, are or will be into the future. And so you're kind of seeing it happen real time. And that's one of the biggest things with human-centered design and this collaborative process that we are dedicated to. But in order to ensure that we're kind of framing things properly, we have 3 broad goals for Brilliant Beginnings. And so that's what you see on the screen right now. And so number 1 of our Brilliant Beginnings goals is collect and connect. So collect and connect data to gain insight into childcare services and facilitate data-driven decision-making. So that's understanding the full spectrum of services. There's so much information in California, and so many services that are being provided, and so much positive and great service that's being provided. And so we want to see how we can gather that information and gain insight from it. And so working together, of course, in partnership. And then also we want to, our second goal is for families and providers. And I want to take a second to note what we mean by providers. So providers meaning in the facility, so licensed providers, and also families, friends, and neighbors, as we call, as we say. So providing the service to children. Looking at families that are receiving the service, and then also the providers that are providing that service to the family. And so what we want to do is maximize the knowledge, choice, and engagement with families and providers by by supporting consumer education, and also the interactions that happen on a daily basis between families and providers. And then lastly, our third goal is, as we mentioned, childcare and development programs just transitioned from Department of Education earlier this year. And so we want to look to build on the capacity of CDSS following that transition. And so how can we improve on what we do to provide a better service? And so that's kind of how we're framing Brilliant Beginnings, this initiative, looking at those 3 goals. But then on top of that, even more important are the priorities for Brilliant Beginnings. And so we have 3 priorities as well. Number 1 is advancing equity. So in everything that we do within Beginnings, we're looking to advance equity. And so kind of ties into the exercise that we just had, prioritizing how technology can be accessible, widespread. And then also, of course, listening to you and your expertise about equity and how to advance it at the local level. It's not the same everywhere. And so we want to understand all of the expertise and all of the lived experience. And then also coupling that information with data to identify, to continue to identify and eliminate inequities. And then, of course, as I mentioned, we have not made any decisions about what we're doing. And so when we get to that point, following along with the nothing for you without you, committing to an approach that's not one size fit all, because we know that one approach does not apply to everyone. Our second priority with Brilliant Beginnings is improving access. So looking at all of the great local approaches to make family or consumer education. I like family education, it's so much more personable. So family education, more visible, actionable, and person-centered. And also looking at how there was a great comment about people are just better. And so following along with that, linking families to all of our fantastic local support agencies to provide that much more hands-on and warm service that so much better than any technology could ever do. And then also, of course, supporting and striving for the full utilization of subsidies. If there is money left on the table in terms of subsidies, that means that there is somebody out there that did not receive the services that they could have. It's not feasible to think that just because there's anything left that means that everybody was served. That's definitely not the case. And so we're looking to support and strive for full utilization of subsidies. And then lastly, our third priority is to strengthen outcomes. And so looking to do that by supporting research and innovation and shared understanding. So looking at ways and new ways of doing things and what's cutting edge, and understanding together how that can work together with all of the services that are provided. And then of course as well, focusing on outcomes and what are outcomes and how can they value be generated, and looking to how data can be a part of that, and decision making to improve the processes that we have for programs. And so of course with goals and priorities there must be a strategy. And so we, of course, have a strategy for doing that. And as it's probably completely evident, the most important thing is fostering partnership. And so understanding where inequity persists, how services can be more accessible, how outcomes can be strengthened together. That's the most important thing, doing it together. And of course, making those decisions when we get to that point, with you rather than for you, or with the community rather than for the community. And then, of course, just like we're doing today, having constant contact and cooperation during all stages of the process that we have. So during planning, where we are right now, in development, and then getting to the point of implementation, and then even to the maintenance of anything that results out of our process that we have. And then at the end of it is when we start to think about technology. Technology should not be the first thing that we think about. What's more important is thinking about the need, the opportunities, the pain points, and all of the different perspectives. Once we understand that and we've really understood how things work, is when we can get to the point of saying, well, how can technology be a part of that? And so when we get to that point, of course, we'll explore innovative ways to use technology to support providers and families in the field more broadly, and also how technology can support transparency across programs and the services that are provided, and then as well enhance the services that we provide in our capacity at CDSS. And so, as I mentioned, we've kind of given a similar presentation before, but to focused, targeted groups. And so today we're here reaching as many of you as we can And so what we do have is some feedback that we've gathered during those presentations. And what I'm going to do is turn it over to Tara to walk through that feedback.
Thanks, Brandon. So like Brandon mentioned, we have had some opportunity to share and to ask some questions already. So what we were able to gather from a few of our different sessions is information and your experience and your initial gut reaction in a way. So when we asked, how do you feel about this? Where are you sitting right now? What is your gut tell you? And folks want to be an active participant in helping shape the system would be used for. We also want, or we also see that they are eager to support accurate data maintenance, and they hope that R&Rs, for example, continue to be considered partners. And in addition, software vendors that already have many of the software products will be understood throughout the Brilliant Beginnings process. Also, looking at what's already in use by agencies in California to understand the full picture. Also, they just want a system that works for providers and parents. So with that, we also have questions that we've asked with some of the responses that we'll list here in the next couple pages. So if we go ahead and move to our next slide. Oh, here we go. We are here. All right. So in one of our questions, we asked, in what ways can technology be equitable? And some of those answers that we received from a few of you were eliminating the need for transportation or a printer, access for anyone with a smartphone, inclusive of disabilities that affect using it, being visual, tactile, closed captioning, multiple language, and just general access. Our next question is, how can access to services and subsidies be improved through technology? So one of those things, online registration, application assistance online, families being able to check application status on their own time, and also that 24-hour access. You need to be able to access it whenever you need to, when your schedule fits, and using technology to outreach services to communities. And our last question that we've asked, in what ways can CDSS foster inclusivity, transparency, innovation, and ultimately collaboration? So ways that we've understood that, and some answers we've gotten, is demonstrate collected input is being utilized. We got to know that what you are providing to us, we're listening, we're actively working on it, utilizing it as we move through this implementation process. Regional meetings to learn about what is working in respective regions, including users and partners in building the system or building the collaboration, and open communication and collaboration, ensuring that we're constantly being transparent with you, that you're very aware about where we're at in the stages, but also where you need assistance, knowing that we are checking in with you, we know your status. So it's a continuous two-way street of communication. So with that, I'll pass it back to Brandon. Oh, just kidding, it's me. So we'll go ahead and present our poll everywhere. We realize that some folks are having some technical difficulties, and it is the nature of this beast about being online, and we recognize that that's very difficult. So however we can accommodate you in being able to see your responses, we will do as much as we possibly can, read into that Q&A session, but it's the same link and same text message. So texting CalFresh CalFresh ET 529 to 22333. So our question here is, what are the benefits of technology in your workspace or field when assisting families? We understand that folks may not have those yet, but if you do have benefits, what may they be? So we see new avenues of accessibility, sending alerts, saving money and time. And we'll go ahead and let this run for maybe a minute, 30 seconds. No transportation and time burdens. Yeah. CalFresh 529. Yep. Saving time, more methods of contact, quick response time, convenience. Oh yeah. Cost effective, technology to find services and resources for families while on the phone. Definitely. All right, accessibility for families, reducing duplication of entering the information over and over again. Yes, more sufficient, more efficient and sufficient. Easy documentation in one place and searchable, yes, accessible data, database security, shortened timelines. Yeah, time assist anywhere. Oh, I love it. As frustrating as it can be, technology can be a really, really helpful tool. I recognize that it's got its pluses and minuses for sure. Pandemic friendly, that's been our most pertinent piece here, is that we're able to help families feel secure and safe and help our families feel secure and safe too. Reduce errors, flexibility, yeah. Improved communication and partnership. Yeah. Providing services in a way that meets clients' needs quickly and efficiently. Supporting data, yes, to individual, employer, yeah, aggregate data. Oh. Connectivity with broader management divisions across cities, yeah, combining folks that normally aren't combined or collaborating actively, definitely. These are really great responses. Yeah, I can appreciate these. All right. So with that, I think we feel good to move to our next question. Please feel free to add some to our Q&A. I'll just ensure that, oh, save trees, save trees. I want to say thank you to that, save the trees. Oh man. All right, so for our next question, what are the downfalls of technology in your workspace or field when assisting families? A lot of folks were able to share that in our first question. And this is important to understand. Lonely, disconnected, yeah. Lack of contingency plan. Access for sure. Can feel impersonal. Not everyone has access. Outdated equipment. That's the most frustrating thing when you can't get that update on your phone and you're like, oh no, I can't have access. What do I do? Many families and providers want to talk to a human. Yes. Communication can be overlooked or ignored. Dependent on a power source. Yeah. Impersonal, miscommunication, totally. More difficulty with contact if not responding. That's a huge problem that that people run into. It's great if it works, but if people don't use it, you know, lack of understanding on how to use it, tech issues at their end or ours, clients feeling left out. Yeah, we have quite a bit of the lack of communication or connection and accessibility, confidentiality. Security, that's a big one. Yeah. All right. Please continue to add just for a few more seconds. Again, like we mentioned earlier, and I will be going into this very shortly about how we will be able to talk about this a lot more and how your information and your experience will be looped into this process and considered as how we are directed and how we move forward in our implementation. It's how you experience it, how the clients experience it, how our providers experience it. We're going to need to understand that. So I'll be able to explain how my team can help amplify that. So folks are still adding in here. And again, I mentioned in our Q&A chat that we'll be able to export these responses, and we'll go ahead and share those with you. And again, I'm very sorry to those that are trying to access. Sometimes it is a security problem on your white wall or your firewall. So if that's possible, we might be able to talk about some contingency plans for next time and ensure that we have an all-encompassing ability to get your responses. So with that, I'll pass it back to Brandon so we can move forward in our agenda. And again, we will share these responses afterwards. Thank you.
All right, thank you, Tara. And I can definitely sympathize with the outdated technology. I have an iPad that's probably 12 or 15 years old, and Disney Plus does not download onto it. And there was a small meltdown when that happened. And so it's definitely across the board. Technology is just improving so quickly. And so ensuring that things are accessible in that way is important. And so moving along, so we've given an overview of Brilliant Beginnings. So the big picture, the initiative. And as I mentioned, we have Calspark, so California Supporting Providers in Reaching Kids, as the flagship project within Brilliant Beginnings. And it is noted as technology tool here. The main thing is it is envisioned as how can technology be a tool supporting providers in reaching kids. And I will note, as of course, just with the Brilliant Beginnings initiative, Calspark is in the very early stages of planning. We're kind of going through things here today in real time as we're working to understand how things can look, which I will get into in the next slide. So you may be wondering, what is the Calspark concept? We don't know what Calspark itself is as a thing because we haven't planned for it, we haven't understood the requirements for it, and we haven't built it and we haven't implemented it. So right now, Calspark is a concept and it's a vision. And so with that vision, we're wanting to explore how technology can support 3 different areas. Now, if you look back at the goals for Brilliant Beginnings, 2 of those goals are consumer education, families and providers, and then state staff. And that translates directly here to Calspark, looking at how we can explore technology supporting consumer education. So with consumer education, what we mean is at the state level, the legislature a few years back passed a bill with a mandate for a consumer education portal to be available that shows California's comprehensive childcare and development services. And also looking at federal mandates with the CCDGB block grant, looking at how we can meet those requirements in a way that are beneficial and in what is needed in the field. So there's requirements, but that doesn't really tell us what to do. It's understanding where the need is and what the opportunities are. And of course, where you are extremely vital to tell us what's important about consumer education provided through an online portal. And then also our second area, of course, is families and providers. So looking to see how we can innovate on that experience of a provider providing a service and a family receiving a service. How can that be innovated on? And so kind of getting into that frame of mind, what are the things that happen on a daily basis? I know there's a lot of things and interactions that I have on a daily basis with my daughter's childcare provider. And so thinking about the ways that can be supported through technology. So that's really the scope when we think about consumer education or family education, and then with families and providers. So it's that service and that interaction. How can we innovate on it? And then of course, the last piece here building on our CDSS capacity following the transition of childcare programs from the Department of Education, and looking at ways that we can improve the services that we provide through technology, and the things that we do internally. How can our staff benefit from technology to improve or speed up or higher quality of services? So kind of looking at all different levels, how technology can support. And it is an open conversation, as it has been here today. So we are looking forward to your input, your expertise, your insight. There is no comment or question that we don't want to hear. And so we thank you, of course. And so that gets into how you're vital to Calspark's success. Because we're in the planning phase, your partnership and collaboration is extremely important, and having many opportunities for stakeholder engagement. A meeting like this is not the only place that there's an opportunity to collaborate with us, to provide input. And so we're looking at how we can maximize the different ways that everyone can contribute. And that's not just with planning, that's also with development, implementation, and maintenance. So the full spectrum of how we get to a Calspark that is successful. And then also, of course, as we've talked about, we'll get into this a little bit more about what is human-centered design. It's kind of a buzzy thing. And so Tara and her team will get deeper into what human-centered design means, and kind of the process that we're looking to follow. But basically, as you see here, we're looking to ensure that we're talking to everyone, and we're hearing from everyone, and we're leveraging your experience and your expertise, kind of leaving no stone unturned as we're looking to develop a successful Calspark. And so I'll turn it back over to Tara to give an overview of human-centered design.
Thanks, Brandon. So human-centered design, as Brandon mentioned, is a buzzy term. Overall, it's a creative approach to problem solving that focuses specifically on understanding all of the perspectives of all that are involved within a movement, a project, and designing the option or designing the ultimate goal, the fix, or the addition for everyone that's involved based off of their experience. So human-centered design is the practice of capturing that information through tools and different types of practices. So the human-centered design unit within the research, automation, and data division is a customer service and resource unit that offers expertise in human-centered design principles, so we can improve project outcomes for all of the folks that we work with, our families, our partners, and our stakeholders. So for myself, I am the manager of the unit, and I have my two specialists with me, Lindsay Russell and Anthony Ruiz. And we are a small but mighty team. So we are very, very lucky to be here on this project and to experience this with all of you. So going into what we're doing here. For what we operate on is business discovery. We're looking to see how do things work within this field, within childcare? And there's so much to understand. So the ways that we will work with you is through research, different types of interviews, and workshops. So our ultimate goal is to just listen and to learn about all the childcare pieces that you're involved in, and to know what are your needs and the experiences of all of our partners. So this way, we can utilize your information to help you work into Calspark, or work into what Calspark will be, and ensure that it's correct, that it's the right thing for you. So within our approach, we'll conduct surveys. Like I mentioned earlier, we're going to be sending some out very shortly, so we'll talk more about that later. We're going to start to map how things work so we can see it visually. We have to understand how things flow, who's involved with certain processes, and how does that work all together. We want to learn throughout focus groups how to understand what you experience and capture how partners are interacting with one another and within our family and provider community as well. So with that, we're going to collaborate with you at the partners on our stakeholder engagement movement to focus on the equity and identifying participants in the family and provider communities to speak with everyone on business discovery. We want to make sure we got the right group of people, that we have the right amount of people as well, so we're accurately picturing our full group. So we're going to work more with you to understand who should we speak with. So for our next steps, so right now we're working on a few things. We're speaking directly with our state partners, with our folks in the Child Care Development Division. We're looking at, well, how do they do what they do? How do they manage and administer policy? How do they work with the R&Rs, the APPs, the counties, the local planning councils, and our tribal partners? And we want to understand a little bit more of that piece before we go in and talk to our families and providers, because we want to understand what are the policies that we're working with. So once we have that mapped, we're currently in that stage right now, we're going to go out and start speaking with our families and providers, with you, and understanding through surveys and different ways to approach. COVID has put a barrier on some of those in-person interactions, but we're doing our best to be able to link with you in multiple fashions in order for us to really hear how you're feeling and what you experience. So we are partnering again with our R&Rs, APPs, counties, LPCs, and our tribal partners in order to accurately and most efficiently set up those meetings. We'll include our advocates, we'll include CCPU and other stakeholders, and continue that, like I said earlier, with surveys and focus groups. Simultaneously, we'll be able to look at the accounting portion, what's happening at our state, in our state processes. So some of that is still in progress. So more information is to come about that. But all of what we're doing right now is just listening. We're just understanding what's happening right now. No decisions or actions or anything is being built quite yet. So we want to make sure we're working with you directly and learning and listening to you as we go through that process. So with that, we can go ahead into our next question. I believe it's just right after this. Is generally your initial instinct, what do you need Calspark to do for you? Understanding and just taking in what you've heard today, your initial reaction, what do you need it to do for you? So your responses here, again, this is a safe space to share this information. Sometimes it's difficult to understand it now, but whichever reaction you have for today will help us understand and to gauge what is our next step? How do we best approach, and how do we best work with you that you have what you need? So making us all more efficient, communicate with different databases, connecting those gaps, yeah. To utilize the systems that are working and not reinvent the wheel, yes, yes. The big thing here is that we are meeting you where you're at. You know, this is a place where the human-centered design piece comes in so effectively, is that we're just pausing to listen. And once we listen, we can continue to react and respond. All right, so developing new technology where needed, comprehensive approaches, saving money and energy. Yeah, less duplication of efforts, streamlining, understanding need for online presence as well as paper strategy, access for APs to data and held or collected by county, DSS, make us more visible to all, commit to continued enhancement. CQI is my favorite. Ensure we have access to own data. Yeah. Patience and mercy as we transition. We may make mistakes. I love that. And that's what I would like to help continue to foster, is that transparent space, that we're all going through transitions in multiple ways, not just here, but everywhere. Leveraging current tools and intake systems. Be a support and not just make contractors data inputters. The folks that we work with do more than just inputting data. They change people's lives. So this is a very important place to make that stand, to say it's more than just data. It's people. Being user friendly, keeping up with changing technology. Data collection is for a purpose. Yes, honoring all families and providers. This makes my heart very fuzzy. I really like these responses. This is really helpful. All right. I think that we are looking good to go on to our next question. And I'm just going to check our Q&A just really quickly. All right. A couple of questions in here that we can take a look at. Just want to make sure that if we're missing anything here, if folks can't participate, that we get those questions. And clearly define user-friendly, wide range of skills, efficient management of changes. Yeah. Pilot project for careful rollout with time for quality assurance. Definitely. All right. Thank you so much for these responses to this question. I'm going to go ahead and transfer into our next question. So the difference here is, what do you want Calspark to do for you? The project in general, it could be our team, it can be the project, it can be a potential solution later down the line. When you hear Calspark, or when you see Calspark, when you experience this information, what do you want it to do for you?
And Sarah, if I can jump in, this is Brandon. At the stage that we're at, this is kind of like the dreaming stage. And so if, let your imagination run wild and, think about, your wildest dreams, what Calspark could do. It's kind of helpful to think in that sense. Nothing is off the table at the stage that we're at.
Thank you, Brandon. Very important to know that this is a place to think crazy. That brainstorming is most effective when you think completely outside of the box and you challenge your expectations, you challenge your initial reactions too. Reducing data entry so we can focus on serving families and providers. Easy to allow more time for direct service.
Nobody does something saying, I'd like to do lots of paperwork. And so I agree, more time doing the fun, rewarding stuff.
Automating reports and data requests. I love automation. Allowing local staff to directly support families and providers that are accessing Calspark. Low or no cost, so every contractor is not guiding or raising funds to support technology. Auto-inform, verify user if they qualify for subsidies. Aligning data fields and definitions. Multiple languages support. Just double check this chat really quick. We want to create one entry point for all reporting and tracking requirements and support the production of data points and information so we can be data responsive in our actions and projections. Whew. Yes, I love that. Definitely love that. Unite, supporting advocacy efforts and telling the story of our families. Yes, yeah. This is fantastic, absolutely fantastic. So like we mentioned earlier, there are going to be many opportunities for us to share and participate in conversations with you on questions like this. Not only the dreamy stuff, we'll get into the weeds as best we can, but we want to support that process for all conversation, for it to be transparent, for it to be candid, but also to be moving in that trajectory to transcend. We want to be able to move forward and up. So with our conversations within HCD and what we will help foster is a continuation of conversations just like this. So please look forward to more of that. We will be in contact and scheduling things very, very soon to discuss with you and to ask you more questions like this. So folks, keep adding. We're going to send this out. You will see all these responses, and I will hand it back to Brandon. Thank you so much for this opportunity.
Thank you, Tara. And let's see, I will transition. We've done a pretty good job here transitioning back and forth. Typically, it's quite the process getting to that point of fumbling through who's talking at any point in time. I do want to make sure, Tara, you have the opportunity to plug the survey that will be forthcoming following this meeting.
Oh, yes. So thank you. So with our survey that is upcoming, it is a quick temperature check with you. How did you feel about this? Are we reaching you correctly? Are we reaching enough people? And it's a place for you to provide your suggestions and to give us an understanding about where you're at in this process. And we'll be able to provide that to you hopefully by the end of the week, if not Monday. So you will see that very soon. We're ensuring that we have all of the correct translations for you. So that way we are encompassing our full audience. So if you have any questions in the meantime, please do contact us here at the Brilliant Beginnings at dss.ca.gov. And we will go ahead and take any questions there, but we will also get to this Q&A here. There's a lot of really wonderful questions here, but that survey is going to be a place for you to pause, consider, and to see how else we would like to move forward with any of your feedback.
Thank you, Tara. As Tara mentioned, we do have an email, and so that's brilliantbeginnings@dss.ce.gov. So we can move into the questions portion. It looks like we have a healthy backlog of questions here. I do want to note that we're getting some questions that are pretty detailed and kind of starting to get into like the solutioning or asking about timeline. And so we can't exactly give an answer for things that we don't necessarily know right now. And so some things we won't be able to answer. Other things we'll be able to answer in follow-up. And then some things we'll be able to answer right here. And so I'm going to try to walk and chew gum at the same time and call out the question. And also we may have other members of the team jump in to answer. And so the first question that we have here is, how will Brilliant Beginnings support providers who may not have the know-how or tools to update information such as their vacancies? Will all providers be a part of BB, which I'm expecting is Brilliant Beginnings, or just those who have subsidies? Will family, friend, and neighbor and exempt be part of Brilliant Beginnings? And so these are great questions, and that was from Esmeralda. And so this kind of falls into that grouping of answers that we can't, or questions that we can't provide full answers to. What we're looking to do, of course, as we've noted, equity is extremely important. That's one of the pillars, as we can say, of Brilliant Beginnings. And so noting the importance of some providers who may not have the know-how. I think it's been noted several times here today. We do something what's called an affinity mapping. And so that's taking back all of the feedback and kind of aggregating it together and seeing, how often something comes up, and that helps us understand, wow, this is something really important because, 70 people mentioned it. And so we will definitely take that back. And then also with the second question about will all providers be a part of Brilliant Beginnings or just those who have subsidies? and so we will take that back to into consideration. I will see if anybody else on the team wants to jump in and provide an additional answer. Okay, hearing none. So I think the second question from Eric, who will be the primary end user customer of the Calspark system? If this is a childcare provider, that is a large term that has many different customer needs depending on what kind of provider. And so I think this was before we kind of scoped what we're looking at to explore for Calspark. And so Eric, I hope that we had been able to answer your question, and it looks like there was 12 upvotes for it. And so we had given that overview of the Calspark concept, so that hits on family or consumer education, families and providers, and state capacity building. And so definitely acknowledging that, yes, childcare provider is a very large term. And so that's why it's important to hear all of the different ways that that could mean. But we did kind of provide a little bit of context into what we mean by provider. So that's licensed providers, family, friend, and neighbor, people that are working with families on a daily basis as that service of childcare is being provided. And so I'll also look and see if anybody from the team has any insight there as well. Right, okay, perfect. And so the next one, also from Esmeralda, will health screenings and other health information such as referrals be aligned with public health in the systems? Will programs have access to the different programs and services that a family and their child have access to? Is there a single point of entry for eligibility? Which is a great question. And of course, there are a lot of different projects that we're working on at CDSS and within Health and Human Services. And so it's something important to keep in mind that the people and the children that are being served may be receiving a service from a different program. And so while we can't necessarily, of course, with a lot of these questions, because we're getting it, like those questions kind of get into the solution phase, and which is where we're in the planning phase. But it's important to note that these are important things to think about. And of course, a lot of these items are things that we've heard in the past. And so it's important to call out as an area that we are exploring. So thank you for doing so, Esmeralda. And so there's another question about, will there be opportunities for various stakeholders to have in-person feedback session on these topics? The exercise assumes that stakeholders are comfortable using technology. And of course, so in the past, prior to COVID, there were a lot of opportunities, and primarily the stakeholder engagement that we had done across many programs and across a lot of the departments, it was primarily in person. And so we've moved to a different kind of way of living with COVID. And so it's, kind of depending on how things go there. But that's a great point and an interesting thing to explore about how can things be done in person, because noting that some people may not have access to technology or may not be comfortable to using technology. And so we definitely want to explore how things can be barriers with engagement. And I'll give an opportunity as I'm scrolling through to the next questions if anybody else wants to jump in from the team. I think there's a really good question here. What is going to happen to providers who have already implemented a software solution? That's a great question and something that needs to be considered. There are providers who have a technology system, and so how how does that look? How does that interaction made, and how do we take that into consideration? And that is something that has also been brought up in the past, and that we've kind of thought about, and we're, like I said, with affinity mapping and noting things as important. And so it's really good to point that out here, and something that we are exploring into the future as we continue our planning process. And so a question about widespread access, including funding to the childcare community to access Wi-Fi, I say Wi-Fi, so if that is kind of odd, Wi-Fi, smartphones, tablets, etc. That is a fundamental issue, and definitely this is something that has come up numerous times, and something important, as of course equity being one of the main pillars of Brilliant Beginnings. Understanding that technology itself, the hardware, is not necessarily accessible, and so exploring that as well is extremely important. And so kind of similar to another question, will this require agencies to use software instead of software already used to manage family caseload? So this kind of similar answer as the previous one. We're definitely taking that into consideration as we explore further for Calspark. Continuing along, looks like we have about 7 minutes. And so we'll continue with the questions. If anyone on the CDSS team would like to jump in, or if there's a question that as I'm working through, if we see that is a good one to address, feel free to jump in.
I have one that I'd love to address that I've spotted in our chat.
Thank you, Tara.
Sure. So one of our folks has asked, who is helping to inform the questions Brilliant Beginnings staff will be asking families? How will Brilliant Beginnings explain the long-term goal of the use of Brilliant Beginnings and the positive impact it will have for families? So this is where my team will help propel this forward of asking the questions to you, to this group, to our state partners within our CCDD group, within our community care licensing group, within our general program areas. We have continued conversations with our state folks, but reaching out to our local childcare partners. We have already been exposed to so many different types of occurrences happening, experiences, issues, pain points, and some opportunities for growth. So we're starting with those conversations. We're saying, what are the things that you are talking about? Not what we're talking or what we need yet, but what are you talking about? And how can we continue to live in that place of conversation? That it's the active conversations you're having that we're moving into and asking more questions about. Now, for the questions that we'll be continuing to we will continue to ask, is we'll be forming those over time, but we'll be able to share with those that share information with us. We'll be working on that collaboratively with you. So those that will inform various, but it won't just be the Brilliant Beginnings team only creating these questions. It'll be multiple people. Now, for the explanation of long-term goal, it's within that collaborative space. We have to understand, what are your goals as a whole, and how can Brilliant Beginnings as a movement, as a project, support you? How can the pieces of Brilliant Beginnings support you, being Calspark and the other portions that we'll discuss? So it's the positive impact that you need that we're going to be able to discuss further. Like Brandon mentioned, this isn't a solution yet. This isn't a built system. This isn't something that is so fleshed out and just ready to hand over and to use, but it's a collaborative build. We're working on this side by side with you, that we inform one another, that we benefit one another as we move forward with it. So that impact and that positive impact will be in reflection of what is needed. So I hope that has supported that, and I'm open to my CDSS colleagues to add in as well.
Thank you, Tara. So I'm kind of having the opportunity to scroll through some of the questions, and there's a number of questions that kind of get to solutions that exist or solutions that are being developed, or kind of things along those lines. And I just want to make sure to note that today, of course, is kind of a visioning conversation to make sure that we're able to get as many people in the same understanding of Brilliant Beginnings in Calspark, kind of on the same page. And then we'll be able to move as we move into the next year into kind of getting to a point that we roll our sleeves up, so to say, and looking at everything that exists and considering how things can interact or operate together. And so we will definitely get to that point because there is a lot of really good technology or systems that currently exist. And so definitely with any new concept of technology, we need to consider what is already in existence. And so I'll, of course, as I'm looking through for the next question, if anybody would like to jump in there as well, feel free to.
Hey, Brandon, I was hoping to check in. We have a couple of folks with their hands up. So I would love to take the opportunity to ask one of them to respond. Is that something that we'd like to do?
Yeah, I think so. Let's see how we can do that. We have about 2 minutes left. So I'll just start at the top with Cecilia. You are unmuted, I think.
She has the ability to unmute.
Okay.
So Cecilia, if you'd like to unmute yourself, you're welcome to speak. And Cecilia, if you have passed on your question, no worries, that we'll keep it open for you to let us know. Our next person that has asked a question is Monica Belton. Monica, you are able to unmute yourself if you would like to ask your question.
I don't know if I meant to make it as a, I'm just kind of just getting familiar with what the work is behind it. So I think I had put my questions in the comment section. Did I accidentally raise my hand? I'm sorry.
It's totally okay. We just wanted to make sure that if you did that you were good. Okay, no worries.
Thank you.
Yeah. The next person on that list is Deborah Corley Marzette. Deborah, do you have a question still? We'll go ahead and unmute or give you the opportunity to unmute here in just a second. There we go.
Thank you so much. I appreciate that, Tara. I'm Deborah Corley Marzette. I'm a family daycare provider here in Kern County, and I am happy to be here. Hopefully I'm not the only family daycare provider on this stakeholder meeting, but I was really wondering, how do you, and I know, Tara, you did say that the Calspark is something new, that you guys are still transforming this, building this, et cetera. But I'm really thinking, how do you plan, or do you have any idea how to really include family daycare providers in this? And as you said, it stands for California Supporting Providers and Reaching Kids Through, it sounds like, technology. So how do we bring family daycare providers exactly? Thank you.
That's a fabulous question, Deborah. Thank you so much for that. So there are going to be multiple ways that we're able to reach families and providers directly. Now, again, we're limited with some of the recent health concerns with COVID-19, but with multiple stakeholders and partners that we have, there's so many windows of opportunity. So places that contain regular engagement. So if you work directly with some of our partners, we'll be able to access different methods of communication. We're also going to have additional support on the Brilliant Beginnings and Calspark project side. So we'll have some extra folks on our side to help with that outreach. Now that will range in a couple of different ways. Some will be those surveys, direct surveys coming to you. Also our focus groups. So focus groups will take place with different subsets of folks that we'll be able to break down in a couple of different ways later on in our process. I do realize we're at time a little bit over time, but I wanted to help answer that for you, Deborah, that there are ways that we would like to utilize the existing methods of communication and also provide new areas to discuss and to ask those questions. So some will be during Zoom, and other opportunities are in discussion, hopefully, but it's utilizing what we do now. So that way you don't have to go so far out of your way to participate in this, and that we can access you where you're at.
Okay, I appreciate that. Thank you so much.
Thank you.
Thank you, Tara. And so just noting that we are at time now, and of course, we can ask your question with a question. So if you would like to tell us how best we can reach you, please let us know. And you can send us an email to thebrilliantbeginnings@dss.ca.gov, because we want to know, of course, what is the best way from your perspective to hear from you, on top of the spectrum of ways that we already have. And to end things off, I want to give everyone who has attended, all of the team, everyone who has made the meeting happen, a huge thank you. And we're looking forward to kind of kickstarting things going into the next year, and all of the great partnership and teamwork that we will have moving forward with Brilliant Beginnings and Calspark. Thank you very much, and happy holidays.